Good afternoon, everybody. I'm Khizar and I'll be presenting this study in front of your audience. After going through so many wonderful ideas, novel researches by my honorable presenters, you must be astonished to see such a basic idea and a very simple thing in this forum. Even I was shocked when I heard the breaking news that I was been selected for this. But this is the theme of this conference, patient-centered care. And I strongly believe that this paper is really good representative of that. So, it's a double-blinded, multi-center, randomized controlled trial in which we compared the efficacy of combination of 0.2% GTN ointment and the 2% lignocaine ointment with each of the ointments separately in terms of post-operative pain relief and wound management in patients undergoing Milligan-Morgan hemorrhagectomy. To begin with, I strongly want to emphasize that this study was conducted in a healthcare system of a developing nation, where there is practically no access of the general population to more recent or advanced treatment for hemorrhoids. More than 150 hemorrhagectomies have been performed in an average-sized district general hospital, and you'll be surprised to know that minimum length of stay is 2 to 3 days, just to attain good post-operative analgesia by use of systemic analgesics. So keeping all this in mind, we designed this study to attain a better, simpler, and more effective post-operative management plan for a very common health problem in an already overburdened healthcare system. We use GTN, which is known for its non-compliance due to headache, and we preferred it over liltiazem because the ease of availability, it was available all over the country, and in our pilot study, we didn't have significant dropouts due to headache. Our primary endpoints were post-operative pain scores. Secondary endpoints were post-operative use of analgesics, the time taken for complete wound healing, and the early complications. The pain score was measured on visual analog scale. Total analgesics used were measured as total analgesics used daily by each group. The wound healing was taken as complete epithelialization of the wound assessed clinically, whereas in early complication, we took wound infection, severe headache, and urinary retention occurring within 4 to 6 weeks post-operatively. So all the adults having grade 3 or 4 hemorrhoids were included and randomized in 3 equal groups. Group A receiving the combination of both the ointments, Group B just the lignocaine ointment, and Group C the GTN ointment. All the patients received standardized pre, peri, and post-operative treatment. They were assessed on weekly basis after 3rd post-operative week by an experienced surgeon who was blinded to the treatment group. The drugs were dispensed by hospital pharmacist in an identical container in order to blind the patient from the treatment group. And to achieve 80% power with 95% confidence interval, we required 70 patients in each group. And we had to assess nearly 350 patients to reach that numbers. And after a few dropouts, we were able to analyze 67 in the combination group, 64 in the lignocaine group, where 61 in the GTN group. Now coming to the results, the demographic data as well as the clinical characteristics of the patients were comparable in all the 3 groups. This is our primary endpoint when we compare the post-operative pain scores, and you can well appreciate this blue line here representing the combination group. The patient experienced quite less pain as compared to the other 2 groups. And the difference was statistically significant from 1st to 4th post-operative days between the combination group and the GTN group, as well as between the combination and the lignocaine groups. And it is quite comparable with the post-op use of analgesics. The patients having combination treatment had taken least number of post-operative analgesia as compared to the other 2 groups. And again, the difference is statistically significant from 1st to 5th post-operative days when the combination was compared with GTN, whereas it was from first to third postoperative days when it was compared with the lignocaine group. You can well appreciate this red line here, which belonged to the lignocaine group. The patient, they healed and took the maximum time to heal their wound. But when we added GTN either alone or in combination, the time decreased significantly, and the difference is statistically significant between the combination and the lignocaine group, as well as between GTN and the lignocaine group. As far as the earlier complications were concerned, none of the patients had experienced postoperative wound infections, although there were some severe headaches and urinary retention, but the difference was not statistically significant. Although cost effectiveness was not one of our objectives of the study, but it was indirectly evident that when we combine the postoperative use of analgesia, presumable less length of stay, and early return to work, the combination group will be the most cost-effective one. And further studies will be required to take quantitative analysis. And I know, and you also know, that this study may not be applicable to the NHS or in the UK as such, but if the diltiazem can replace GTN, then it can be of some help in certain areas of NHS. So at the end, I can safely conclude that the combination group has got better efficacy than either the ointments alone in terms of postoperative pain relief and healing of wound. And I also believe that this simple study can change the postoperative management plan of a very common disease in an already burdened society. And presenting on this forum, this has strengthened my belief, yes, that small things, they can matter. We don't need to be in an ideal world or equipped with all the labs and gadgets to bring a change. We can do it anywhere in the world with minimal facilities available. I thank you all.